Hi guys, welcome to this week's edition of Frequently Asked Questions with Sheriff. Today we'll be touching on a very important subject that affects ladies, especially most women in this part of the world. It's called traction alopecia. Now, you need to know this. Chances are, at some point or the other, you've come across ladies who have experiencing this type of hair loss. Traction alopecia usually results from, mechanical pull to the follicles, especially in the frontal areas of the head. And what causes this? It's as a result of consistent tight braids. Tight braids, Ghana weaving, plaiting of the hair, anything that subjects the frontal hair to pressure, you'll notice that it pulls the follicles with time. Now, if you detect it early enough, or you're informed about this and you stop the practice, the hair could come back. But if it gets to a point where it's quite extreme, leading to what we call bald patches in the sense that the follicles have been pulled out from the roots, then the only remedy for that would be for you to have a hair transplant surgery to replace the follicles that have been lost. Like I said earlier, if it's still in the early stages, it's either it returns on its own, or you could have other therapies like PRP, mesotherapy to help restore the follicles that are weakened by the tight pull. But when it gets to a point where you have the bald patches, which is very common, if you have those bald patches, you need a transplant procedure, a surgical transplantation of active hair follicles from a donor area of the scalp to implant along those areas to cover that bald patch. And after some months, after a transplant, the newly transplanted follicles grow to restore the edges. So it's always advisable to prevent this. You could always ensure that when you're doing your plaits or your braids, you don't let them be too tight. But once they're tight and they continue to apply, pressure to the frontal areas, you end up losing most of the follicles. And when you have those bald patches, the hair transplant is the only remedy that we would be able to offer you at that time. So of course, we always advise you to come in for a free consultation, discuss with the consultant, have your scalp assessed to check if you would need a hair transplant procedure. But we're always here for you. Thank you very much.